Good afternoon. My name is Brigida Morris, and I'm with East Carolina University. I am a master's in social work student, and I will be presenting today on person-centered therapy. So the objectives from today's presentation, you will become more informed about person-centered therapy. You will understand the history of person-centered therapy. You will understand and learn key concepts of person-centered therapy, as well as learning therapeutic techniques and applications which can be used in treatment. Just first off, a little bit about the history. Person-centered therapy comes from the principles of Carl Rogers, which was originally developed in the 1930s. Person-centered therapy was originally derived from the humanistic approach, and it also was originally to work with children. But we have found that through the years, person-centered therapy is an approach that focuses on working with all ages and groups, and specifically working with those individuals that have borderline personality disorders, anxiety, depression, and some other diagnoses such as schizophrenia. So what is person-centered therapy? Person-centered therapy is also known as client-centered therapy, non-directive, the Rogerian therapy, which means the client is their own expert at themselves. The client is the person that knows what will work best for them. Person-centered therapy is, again, not intended for any specific age group or any subpopulation. And it has also been associated to work well with individuals suffering from depression, anxiety, substance use disorders, cognitive dysfunction, as well as personality disorders. Some of the goals of person-centered therapy is to increase self-esteem. When you have a positive self-esteem, you have a tendency of being happy and just being more well-rounded. Also having a greater open to experience, being self-actualized, you will become more open to different experiences in life, and you will learn to trust your own decision-making skills. So some of the key concepts of person-centered therapy, of course, is that it's a humanistic influence on person-centered therapy, and that again is one of the major influences of person-centered therapy. You become self-actualized, which means you refer to yourself in developing a way of learning what works well for you. Also, conditions of worth, which is a way a person self-conceptualized is shaped from importance of his or her own life. Who's important to you? What's important to you? Also referring to judgmental and critical messages from important people, influential people. A lot of times that may come from our support systems, such as our church members, important family members, or those that hold those positive relationships with us in our lives. Being that fully functioning person, that is the ideal that you want to take away from person-centered therapy, is to be that ideal person, being in the ideal emotional health, being well-rounded and open to experiences, and being able to trust yourself and others. Phenomenological perspective, it refers to the unique perception of each individual and you knowing your own world, you being in your own world. The individual experiences and perceives your own world as you react in individual ways. So person-centered therapy is unique and different to each individual person. So let's talk about applying the person-centered concept. So to facilitate clients' trust and having the ability to promote self-awareness and self-esteem, to empower clients to change and have a willingness to change, and to encourage congruence in the client's behaviors and feelings. Also to help people gain the ability to manage their own lives and become self-actualized. With that, this allows the client to be honest and open about the process and without not feeling judged by a therapist when they're in working with their therapist. some therapeutic techniques and methods of working. First off, the techniques comes from when therapies are often focused on something that the client can do in the session. That kind of means when the client comes in, as a therapist, we kind of take the lead, but we also allow the client to have some say-so in their treatment and how the session goes. So again, it allows them to be more self-aware, and the session is more person-centered. Congruence is that the therapist is genuine and authentic in what they say within that session. Unconditional positive regard is when the therapist is accepting, respecting, and caring about the clients. Just showing that positive regard when you're interacting with your clients. It also, unconditional positive regard does not mean that the therapist always has to agree with the client, but shows a level of respect when the client is speaking and discussing his or her feelings. Some additional techniques, of course, is empathy. And this is a skill of showing that you understand the client's emotions, you understand how they may be feeling or the emotions they may be presenting with. Non-directiveness refers to allowing the clients to be the focus of the therapy session without the therapist giving advice or implementing strategies or activities. So again, non-directiveness kind of shows that the client is taking the lead on his or her treatment. One of the examples of empathy is that if a client is making statements saying that they feel that no one cares about them and that they're alone, an empathy response would be, so I hear that you're feeling that no one cares for you or no one cares about your situation. A sympathy response would be, I'm sorry that you're feeling this way. So with any techniques or principles that are implemented, there are always strengths and weaknesses. So with person-centered therapy, we'll take a few minutes to look at the strengths. It is up to date, and the person-centered therapy has a very optimistic perspective. The aspects are relevant to multicultural perspective, provides a platform for other therapies that can be utilized in conjunction with